Hi there, Greg Gunther from the Podiatry Hive. In podiatry and working with patients a lot, we actually are in a diagnostic situation where we're often trying to get to the heart of a problem. And often when we're working with people and staff and the like, again, we need to think about how can we, or what sort of structure is it that we can really get to the heart of issues perhaps that we're confronting with them. So this is something that was developed quite some time ago by a fellow, and it's just called S.P.I.N questioning, and it's a really nice sort of sequence of questions that you can continue to use to drill down to help you really get to, as I say, the heart of particular issues. So, and S.P.I.N just simply stands for situation, problem, the actual implication, and also the need. So it's just simply a way that we can think about that. So just to give you a context and what that actually means, what we mean by situation questions is, at this point we're actually at a fairly high level and we're just asking open-ended questions about the particular situation that might be. So if it's with a patient, it might be, what are the sorts of pain is it that you're feeling, and what are the sorts of things it was that you were doing when you're feeling this pain. So it's really just trying to get a global feel. If you're working with some of your staff and they're coming to you with a particular issue, you want to actually understand a little bit more about the issue itself. So, if it's actually they're having a problem maybe with one of the other staff members, you can ask about, what's the situation where this has actually arisen. Again, it's just really open-ended questioning. And once we've got that understanding, they then need to sort of move through to, the problem. So when we talk about problem questions, we're really actually asking more questions one layer down, if you want to think of it that way, which is actually trying to highlight what the problem itself is. So, it could be that, I'm having trouble with my running, for example. Maybe I'm just having, suffering some level of pain when I'm actually doing some of my running exercises. So it's just really trying to bring the problem down to that sort of individual level. The next thing then is, what are the implications? So if I follow the theme through of the running exercise, it might be that, I've got a competition that's coming up in 2 months' time that I'm training for currently, and if I'm missing my training, it's such a situation that I may actually miss that race, and that's not something I really want to do. So it's really a strong implication from that point of view. So really understand, what the questions are that you need to ask around identifying what the implication is. And then once we do that, we then establish the need. So what do we need to do now about this? And this, particularly as podiatrists, you can start to do your diagnosis now. And this is when you start to put together your plan. So what's the go forward here? So we need to do this, this, and this, and we need to catch up with you in 8 weeks' time just to see how that's progressing for you. So just remember S.P.I.N, situation, problem, implication, and need. And if you can just get your mind, when you've got an awareness around this, when you're working with people, patients, people, just have that sort of framework in your mind, and you'll find you'll get to a much more succinct and clear path forward.